Okay, welcome everyone. My name is Jamie Eidlin. I'm the Associate Director of Graduate Admissions here at Penn Nursing. Some quick housekeeping before we get started. I ask that you stay muted during the presentation and to save your questions for the end. A recording of this presentation will be emailed to you in a few days, so if you'd like to review it or you have to leave at any time, that's perfectly fine. And we probably won't be able to get to everyone's questions, so you can always send us an email at admissions@nursing.upenn.edu with any additional questions, or if you have a question that is detailed or personal, again, just feel free to send us an email at any time. Today, we will be discussing our graduate programs. We won't be talking about the accelerated programs, the accelerated BSN or BSN MSN, and we won't be discussing our postgraduate programs. So again, if you have any questions about those, send us an email and we can let you know about upcoming events for those programs. We'll also talk a bit about our application requirements and some tips, briefly go over student services and financial aid information, and then I will take your questions. First, we'll start with our MSN programs. We have 8 advanced practice or nurse practitioner programs. Our nurse midwifery program is called an advanced specialist program, and that's a dual degree program. You're eligible for your women's health and nurse midwifery certifications. All of our programs loosely follow a similar structure, which I'll go over in a little bit. And we also have 2 administrative programs, health leadership and nursing and healthcare administration, which, as the name implies, are focused more on the administrative side of nursing and do not lead to an advanced practice license. Our MSN programs are anywhere from 1 to 3 years. You can complete most of our programs full-time in 1 year. Our longest programs are our family, NP, and nurse midwifery programs at about 1.5 years full-time. Or you can do our programs part-time, and those take between 2 and 3 years. All of our programs are on campus in Philadelphia. We are returning to in-person teaching this fall and will remain in person for the time being. Your clinical placements are organized by the school, and clinicals take place in Pennsylvania, New Jersey, and Delaware. If you are not from the area, those states are pretty close together. Depending on where you are, New Jersey and Delaware are only about a half hour from Philadelphia. And upon graduation, you're eligible to sit for your program's national certification exam. So you can go practice in any state upon successful completion of the certification. If you do want to practice outside of Pennsylvania, there might be additional requirements based on your state, but the program allows you to sit for that general national certification exam. Some of you may know exactly what program you're interested in, others are still figuring that out. Our programs are based on the APRN consensus model, which states the focus of care is based on the patient needs, not the clinical setting. So that means if you want to be a pediatric primary care nurse practitioner, you can only treat pediatric patients in a primary care setting. This doesn't necessarily mean you can or can't work in a hospital or another organization. It just means it restricts the level of acuity and the patients that you are taking care of. So just something to pay attention to if you are deciding between populations and acuity level. This is a very basic outline of our clinical MSN curriculum. All of our programs start with the 3 Ps, or the core curriculum: advanced pathophysiology, pharmacology, and physical assessment. Every MSN student takes a research course. You take theory courses in your population area, and then you have your clinical placements, as I said earlier. These are very basic outlines of our administration MSN curriculum. The health leadership program, the curriculum is a little more flexible. You have more electives. You can also take electives at other Penn schools, which is a great opportunity. A lot of our students in these programs might be interested in business and law, and it's a great opportunity to take classes at those schools. Our nursing and healthcare administration program. The program is a little less flexible. There are more required courses. This also has a practicum, which is 240 hours working at an organization on a large scale project working with a nurse leader. You also have the opportunity to minor in certain areas. Some are just designed to increase your knowledge in a certain area. Others do lead to certifications. So for example, if you minor in adult oncology or palliative care, you are then eligible to sit for the certification in those areas. The ones with an asterisk next to them can be completed as a standalone postgraduate certificate. So for example, you do your MSN program at Penn, somewhere else, and you decide that you now want to be certified in palliative care, you can come back and take those 3 classes and get a certificate in that. As I said earlier, our MSN programs can be done full-time or part-time. Part-time, you can start in any semester, spring, summer, or fall. Full-time, there are specific start dates for each program. So again, just keep that in mind if you are applying full-time. Some only start in the summer and some only start in the fall. There's a lot of text on this slide. This is all on our website. It's taken directly from our website. Our acute care programs require work experience. They all require at least 1 year in that specific area. The neonatal program requires at least 2 years in a NICU. All of the work experience should be full-time, calculated after orientation, and that's important because orientation can last a few months and be within the last 3 to 5 years. If you are unsure if your work experience meets these requirements, you can email us your resume and we'll let you know before you apply. Our primary care programs do not require work experience, but our most competitive applicants typically have at least 1 year of work experience by the time they are applying. And across the board, across all of our MSN programs, our incoming students have an average of 3.5 years of work experience. So just to clarify, because I always get questions at the end of the presentation, which programs require and do not require work experience. Our acute care programs require work experience. Our primary care programs and our administration programs do not require work experience, but it is strongly preferred. We also have a non-degree option that I'd like to share. If you are in the area, again, because our classes are in person, you're not quite sure what program you're interested in, or you're looking to boost your academics, prospective applicants can complete up to 2 non-clinical master's courses as a non-matriculated student. So most students will take pathophysiology and pharmacology. There's a very quick application and the deadlines follow the MSN cycle, which I'll get to at the end. So this is a nice opportunity to get your feet wet in the admissions process and the academic process. Maybe you've been out of school for a while, and these classes will transfer in if you do well in them to an MSN program. Next, I'll go over our D&P programs. First is our D&P in nurse anesthesia. This is only offered on a full-time basis and it's 3 years long. The program's also in person on campus in Philadelphia. You only need your BSN to enter the program. You don't need any advanced degree. We admit about 2 years in advance. So if you're applying this year in 2021, you're applying to start in summer 2023. Our 2022 program is already closed. We are not accepting applications for that entry term. The next available entry term is summer 2023. There is a specific work experience requirement for this program. You need to have at least 2 years of full-time RN experience post-orientation in ICU or critical care, working with the most critically ill patients. And there are several areas that we don't accept, which are on the screen. Again, our most competitive applicants typically have 2 to 3 years at time of application. So we strongly encourage more work experience, makes you a more competitive applicant. The curriculum is fully integrated between your didactic courses, simulations, and clinicals. Some programs you first do a year or a year and a half in the classroom, and then your last year is all in clinicals. We start you pretty much right away. The program starts in May, and by August, you have started your clinical rotations. We operate on a primary site model. So you have your primary clinical where you start, and it's your home base. So after you rotate through your specialty rotations and other required rotations, you always return to your primary site. And it's a great way to build connections and use everything that you've learned in your specialty clinicals and apply it to a familiar environment. And a lot of our students wind up getting hired at their primary site, so they really have a great relationship with them. We have 2 postmasters DNP programs. The first is the postmasters DNP programs. This requires an MSN or master's degree in nursing. There is no specific work experience required. We do like to see a few years of work experience, but you do just need your MSN or master's degree in nursing. This program is designed to expand the skills of master's prepared nurses, to translate evidence to improve clinical practice and the health outcomes of specific populations. We also have our relatively new executive leadership DNP. This is going to be the 2nd year that we are offering this program. Our first class is entering this year, which is very exciting. This program requires an MSN or a master's degree in a related field, such as an MBA, an MPH, a master's in healthcare administration, and 2 years of leadership experience and fiscal management experience, but we prefer more than 5 years. We're not very prescriptive with this. So if you, again, are not quite sure what program might be better for you, you can email us your resume and we'll help you guide you to that. Additionally, if you have more fiscal management experience on the academic side, maybe you got your MBA, that is an example of something you could accept as well. So again, just feel free to email us if you're not quite sure. The Executive Leadership DNP program provides master's prepared nurses who already have leadership experience with executive level skills to lead systems and organizational change. This also has an interdisciplinary curriculum, so you'll be taking classes in the Nurse Leaders program with the School of Medicine in the Public Health Department. So there's a lot of interdisciplinary options for the Executive Leadership program. Both of these programs are 100% online. Most classes are offered asynchronously, which means you do not have to be logged in at a certain time to listen to your classes. They are both 2 years, offered on a part-time basis. And there are a few on-campus intensives, for each program. Usually there's an on-campus intensive right before you start the program in late August, and then usually the 2nd year. This is the sample plan of study for the Postmasters DNP program. And again, this information is online, and we do have course descriptions for this program, or online for the program. And this is the sample plan of study for the Executive Leadership DNP. And the courses in red are what differs between the Executive Leadership and the Postmasters program. And last but not least, we have our PhD program. There are two goals for the PhD program: is to develop as a scholar and as a scientist. Your end goal, your dissertation, is examining a research phenomenon within nursing and examining it as a nurse scientist. One of the driving factors of our admissions decision is fit with faculty. So you are strongly encouraged to reach out to faculty who align with your research interests and may be a good mentor. We have a list of our faculty by research interest on our website. So you can reach out starting now if you plan on applying this year. Every year we receive very qualified applicants, but we just don't have faculty who are doing research in that area or who aren't a good fit for that faculty, for that applicant. So we really encourage you to reach out to them first to make sure that you may have an available mentor. Our full-time students are fully funded for the first 4 years. That's September through May. It's not 12 months, it's 9 months. Which includes a living stipend and covers tuition, fees, and health insurance. And this program is also on campus. This is a very basic outline of the PhD curriculum. You have a statistical course sequence that you need to take, and you can take that at other Penn schools. So again, some people might find that the Wharton statistical classes might align better with their interests, or the School of Social Policy, their stats courses might align better. So another great opportunity to explore other Penn classes. You either come in funded through a teaching residency or a research residency. So you'll either be a TA or you'll be conducting secondary research through another research center. And the median time to degree is about 3.92 years. So it will vary based on your research and your dissertation, but most people can finish within 4 years. Now, I could talk about the Penn Advantage all day, but I've just narrowed it down to 4 points. The first is community focus. We've been online the past few years and we're all really excited. Past year, feels like a few years. We've all been online the past year and we're all excited to get back together in person. But the community has remained really strong throughout this past year, and we've done a lot to maintain that sense of community through virtual events, trying to do safer in-person events now that restrictions have been relaxed. So there is a strong community focus within our school and then outside of the school as well. We're located in West Philadelphia, so we'll put on a lot of events for that community. For example, the Center for Women's Health has put on a West Philadelphia Community Day every year, where they offer different health resources, events, and educational offerings for the community members in West Philadelphia. And your clinicals, whether in Philly or outside, all have a community focus because, again, that is an important part to us. We have national and international opportunities when we can. Some programs, you can complete your last clinical in another state, depending on the agreements that we have. There are also international opportunities as well. For our MSN programs, we offer short-term study abroad options. For our other programs, you can do, over spring break or over winter break, different opportunities. Some have international clinicals, again, for your last clinical. So hopefully that should be coming back soon, but another great opportunity that sometimes you don't often have in grad school. All of our programs have a strong emphasis on research, even if they're not a DNP or PhD program. All students can get involved in research. For our MSN programs, the research class, you finish with a paper that can be published. So a lot of our students will go on to publish in journals, present findings at poster presentations and conferences. So again, a great opportunity that you don't have to be enrolled in a doctoral program for. And then lastly, we're training all of our students to be leaders, not just leaders in healthcare, but leaders in their community. We are politically active. We will go to Harrisburg, the state capital, and lobby for certain things on lobby day. So for full practice authority, or if there are bills that concern nurses or NPs or patients, will often be there. So again, training you to be leaders inside and outside of wherever you will continue to practice. We find that's very important for our students. Okay, application requirements and tips. These are our application requirements. I'll go over these in a little more detail for each of these requirements. First, in general, what do we look for? We have a holistic application process, which means we are looking at all parts of the application. No one is more important than the other. Of course, we are looking for a strong academic background and a demonstrated interest in the program and glowing recommendations, but you do not get extra points or you do not get points removed. In fact, there are no points for certain items in your application. We look at the entire picture. So we look at your academic performance, we look at your academic history, we also look at your trajectory. So it's okay if you struggled a bit in the beginning. We know sometimes people do, we are all human. So we want to see that you've improved, and if you have, that goes a long way. We're looking at your essays. Are they well written? Do they demonstrate your interest in the program and the role? Supportive recommendations that comment on all the wonderful things that would make you a great nurse practitioner or PhD student or CRNA, RN and healthcare experience, and diverse backgrounds and experiences, which is very general purposely. We are not just looking to check boxes. We want a diverse class in terms of experiences and geographic makeup and past work experience and life experiences. So you can feel free to include all of that in your application. Recommend you start your application early. The application will open July 1st, so you can't start it yet. But when it opens, I recommend just starting the application. There's a lot of questions, just getting a feel for what's required, so you're not waiting until the very last minute to submit. Your resume should show all professional experience, and this is not an exhaustive list, but it can include volunteer experience and extracurricular activities, honors, awards, leadership, shadowing experiences, research, if you've been a clinical instructor, significant hobbies. Most people submit between a 1 to 2 page resume, but there's no specific requirements for that. The essay questions, the basics, make sure it's easy to read. We're staring at the screen all day reading applications, so it goes a long way when they're easy to read. Make sure it's double spaced and a 12-point font. That really helps. Make sure you proofread. 1 or 2 spelling mistakes isn't going to make or break your application, but no one's first draft is a perfect draft, so make sure you don't submit that. Make sure you go back and reread. The harder it is to understand, the harder it will be for us to evaluate you. Make sure to preview once uploaded, so any track changes are removed. It doesn't look strange on the screen, because whatever you see is what we'll see. In terms of content, there are many different nursing programs. We want to know why this program, why Penn, what interests you about the role and the program you're applying to, what interests you about the population and acuity level you're applying to. How have your experiences prepared you for this program or this role? Demonstrated interest of the research, your research interest or your project interest That's for the PhD program, the postmasters and executive leadership DNP programs. There is a DNP project for the nurse anesthesia DNP program, but you don't need to discuss that in your admissions essay. And we also want to know your career goals and aspirations. Of course, we don't expect you to have a fully mapped out career plan. That's part of the reason that you come here, but we want to know that you've thought about it and that you've thought about your future with this program. For letters of recommendation, 3 letters are required, but you can submit up to 5. You don't get extra points for submitting more than 3. This is just a good option for you if you have additional recommenders you want to use. We like to see 1 academic, 1 employer, and 1 professional. It's okay if you've been out of school for a number of years and you don't have a strong faculty or advisor recommendation. On the flip side, if you have been out of school for a number of years, but you still keep in touch with a faculty member or advisor, that's perfectly fine. You can use, an older recommendation. Employer should be your direct supervisor, a manager, and professional can be someone else in your professional career. So a former supervisor, maybe there's a nurse educator that you've worked really closely with, someone else who can comment on your professional abilities. In general, we're looking for quality, not name recognition or Penn alumni. It's great if they're alumni, but that doesn't mean as much to us. We'd much rather see a quality recommendation from someone we've never seen before, or who doesn't have a fancy title. They don't need to be a dean or CNO to write a good recommendation for you. Your recommendation should build upon other aspects of your application, and it can emphasize strengths and weaker parts of your application. So if you're concerned about your academic history, but you did really well in a class, you could have a professor write a recommendation for you. And we only accept academic or professional recommendations. I'm sure your mom or aunt or grandpa or best friend could write a wonderful recommendation for you, but that's not what we're looking for. And yes, we have received recommendations from them. The GRE, as of July 1st, the GRE is no longer required for any program, so you do not need to submit a GRE. Previously, it was required for the PhD program and for MSN programs based on GPA, but it is not required for any program. The TOEFL or IELTS is required if you're a non-native English speaker or if your undergraduate degree was not conducted in English. The TOEFL and IELTS requirements are on the screen. We don't have a preference, you just need to submit one. We require transcripts for your BSN program and all additional degrees or coursework completed. If your BSN is your second degree, we need your first degree. If you took any other courses, if you received any other degrees, we need transcripts from all of them. You just need to submit your unofficial transcripts during the application. Official transcripts are only required if admitted. And international transcripts must be evaluated either through WES or CGFNS. Other application items. You do need to upload your RN, and if you have an APRN license, your APRN license. Upload whatever you're issued, a scan of your physical copy, screenshot of the online certificate. It doesn't matter, just upload whatever you're given. If you're an international applicant who's licensed to practice in another country, if you're not licensed to practice in the United States, you do need to complete the CGFNS certification exam. All of our programs require a statistics class. This just needs to show up on your transcript. You don't need additional information unless it does not show up on your transcript. Our Postmaster's DNP and Executive Leadership DNP requires a form that verifies your clinical hours, which can be accessed in the application. And our interviews are by invitation only. We will contact you. I want to briefly touch on student services. I think a lot of times when students come in for a graduate program, especially a part-time program, they might not think that they have access to these services. But our students have access to all University of Pennsylvania services. So you're not just coming in for Penn Nursing, you are a University of Pennsylvania student. So we have our own Office of Student Services within the School of Nursing that helps with registration, advising, student life, and graduation. The school has a career services office, which has so many wonderful resources. Some of you may not have applied for a job in quite some time and will have to after graduation. So they can help with mock interviews, sprucing up your resume, cover letter. We also have career fairs throughout the year. There's counseling and psychological services. Graduate school can be a big change. Maybe you are in therapy, want to continue therapy, maybe you want to start. So there's individual and group therapy, there's career counseling, whether you want multiple sessions, you just want to talk to someone, really wonderful resource. The Weingarten Learning Center, they offer the Office of Learning Resources. Again, graduate school is a shift. Maybe you need help writing an essay. Maybe you want some study skills to work on. Whatever you need, helpful, no matter what level of degree you're coming in with, they have resources for everyone. Under that is student disability services. If you need any accommodations whatsoever, you can work with them. There's student health services, which offers primary care, sports medicine, massages, and other stress reduction offerings, which is great. And then the Graduate Student Center has a lot of different events throughout the year. The Family Center is housed under that. So if you're coming in with a family, they have resources there. When we can go back in person, that's another place to hang out, study. They have free coffee during the year. So, always good to stop in and get a coffee. And now I'll talk very briefly about tuition and financial aid. I encourage you, if you have specific questions, to reach out to the financial aid office directly. I'm not a financial aid officer, but we have financial aid officers who can answer specific questions. Tuition and fees for all of our programs are available on our website. Very basic, your program cost depends how many course units you take per semester. The average course at Penn is worth 1 course unit, and it's equal to 4 semester hours. These are the 21-22 tuition and fees. There's no difference between in-state, out-of-state. There's a slight difference between summer and fall and spring. The full-time is an estimate that includes estimates for personal and living expenses. The full breakdown is available on our website. These may not apply to you. You might have less expenses for housing or more expenses for personal items. So check out the full breakdown on our website. Again, this is just an estimate. We do have some need and merit-based awards for our full-time students. We have a new scholarship called the Gutman Leadership Scholars. The president of the University of Pennsylvania, Amy Gutman, and her husband donated $2 million last year to the School of Nursing. That was their own money, which was incredibly generous of them. So we have been offering scholarships since last year through this fund, and that is available on the application. We have veteran and GI benefits. We participate in the post 9/11 Yellow Ribbon Bill. If you're a Peace Corps volunteer, there are scholarships for returned Peace Corps volunteers. If you're an employee at Penn Medicine and the Children's Hospital of Philadelphia, that's any Penn Medicine or CHOP hospital, we have a scholarship called Buy 3, Get 1 Free, as we like to call it, where if you take 3 classes in a calendar year, that's January through December, Penn Nursing and CHOP employees can receive a scholarship for the 4th class taken in the same calendar year. And that's in addition to any benefits you receive through Penn Medicine and CHOP. For additional funding opportunities, many of our students have to take out loans. There are a variety of loans. There's public loans, there's private loans. That really depends on your situation. Sometimes some are better than others. So I encourage you to look into all opportunities. There are also federal loan repayment programs. If you have federal loans, you can enter certain programs to have them repaid after a certain amount of work experience or working in a certain area. And there are also external scholarships. We have on our website a list of external scholarships you can also explore on your own. It may take a lot of work, but you would be surprised what they offer external scholarships for. And you may be able to find some opportunities based on where you live, your background, if you were involved in any clubs or organizations in college. You'd be surprised at who offers funding for what. Now we have our application deadlines. So for MSN programs, we have one deadline per enrollment. However, applications are reviewed on a rolling basis. So if you're applying for part-time spring, if you want to start spring 2022, you need to apply by October 15th, 2021. The latest you'll hear back is mid-December. Now, you might apply and your friend might apply, and your friend might get an interview a week after applying. That doesn't mean you're not getting an interview. You might not be contacted for another 2 weeks or another 3 weeks. So we ask that you just remain patient. We have a lot of applications to get through, and sometimes you're not contacted for an interview right away. If you're interested in enrolling full-time, the deadline is November 1st, 2021. Full-time summer, you may not hear back until mid-February. Full-time fall, you may not hear back until mid-March. If you're interested in enrolling part-time summer or fall, you don't need to apply until March 15th, 2022. The latest you'll hear back for part-time summer is late April, and the latest you'll hear back for part-time fall is mid-May. For our nurse anesthesia program, the deadline is November 1st, 2021. And remember, we're admitting for 2023. The latest you'll hear back is late April. For our postmasters DNP and executive leadership DNP, the deadline is November 1st, 2021. The latest you'll hear back is mid-February. And our PhD program, the deadline is December 1st, 2021. And the latest you'll hear back is mid-February. All right, now I'll take questions. If you want to type your question in the chat box, please do so, and I'll try and get to as many as I can. Again, if you have super specific questions about your background, feel free to reach out via email, but we'll try and keep the questions a little more general here for the Q&A.
You're only accepting questions in the question box, is that right?
I'm sorry, if you could type your question in the chat box, that'd be great. Thank you. Okay. So we have a few questions about commuting. For the PhD program, when you're in classes, you could be on campus anywhere from 2 to 4 days a week. It depends on your class schedule. It also depends on if you are a TA or a research assistant, you could have additional on-campus requirements. Which is the program for candidates without a nursing background. That's our accelerated BSN program. We didn't talk about that today, but if you want to send an email, we can send you more information. Are there research opportunities in the CRNA program? Yes, you complete your, it's called the DNP project, which is a research project. Since the CRNA program is pretty rigorous, most students work in groups, which is a nice opportunity. And a lot of times, hospitals and organizations will come to us with a project that they are interested in pairing with a student. So as I said earlier, you don't have to come in knowing your DNP project. That's something you can work on with an advisor, and perhaps be offered a project that you might find interesting. For the CRNA program, would it be valuable to have a surgeon or intensivist write you a letter of recommendation? Sure. Again, we do want some sort of supervisor to write you a recommendation. If that is the surgeon, then great. If they can speak about the skills that would lend to make you a strong CRNA and CRNA student, that would also be great. I live about an hour and a half from Philadelphia. Would it be possible to complete this program living this far away? That is up to you. We have had people commute as far as Boston and Washington, D.C. I'm not saying it's easy. That's up to you and your interests. If you're only going part-time, you may only be on campus 1 or 2 days a week. But keep in mind, when you get to clinicals, they could be in Pennsylvania, New Jersey, and Delaware. So just because you're an hour and a half from Philadelphia doesn't mean you'll be an hour and a half from your clinicals. So just something to keep in mind. What opportunities do students in the MSN program have to conduct on-campus research? So you have your research class, which for many students satisfies their interest for research. You can be a research assistant with faculty, or also one of the hospitals as well might have research positions. Correct, the PhD program is not online, it's fully on campus. Do you accept transfer credit? I have an MSN interested in the midwifery program. We do accept up to 2 classes. However, transfer credit is not guaranteed and it's only evaluated after the admissions process. Another question about transfer credit for the CRNA program: would the courses change if you already have an MSN? Again, you may be able to transfer in 1 or 2 classes. It's rare for the CRNA program due to the curriculum. I'm from India and will complete my BSN in July 2021. Can you apply for the MSN? Again, for our primary care programs, we do not require work experience. So you could apply for a primary care program. Our acute care programs require at least 1 year. Neonatal requires 2. So you would need to wait until you have that work experience. If school was a long time ago, to get an academic reference, would I double up in one of the other categories? Yeah, most people just submit professional recommendations if they can't get a strong academic reference. How do I figure out whether Penn is the right school for my areas of interest? I have my BSN and MSN from Penn, but it may not be the right school for my PhD. It may not be. We'd love to get you back for that triple degree. I'd encourage you to go to the faculty portion of our website and type in your research interest. You might need to make it a little more general in order to find potential matches, and start reaching out to faculty and see if they are available to mentor for this year and align with your research interests. Again, we would love for you to come to Penn for your PhD, but you're right, you might not find you know, a faculty that align with your research interests, and that's okay. Even though the GRE is no longer required, it is still considered favorable. I have my master's. If you feel that you struggled in your undergraduate degree, it can be helpful. We'd rather see supportive recommendations or advancement in your career, certifications, things like that. If you've already taken it, you can submit it, but we typically will not be focusing on the GRE. I'm interested in the PhD program. Do you know anything about the nursing history research through the Barbara Bates Center? Yes, we have the Barbara Bates Center, which focuses on nursing history. There is a really fascinating timeline on the website. I encourage you to explore it, even if you're not interested in a PhD program. I think it's interesting and it's very unique that we research nursing history. I encourage you to reach out to the faculty there to see if they align with your interests. Can you talk about the CRNA clinical sites? Are they all in Philadelphia? Most of the primary sites are in Philadelphia. Some are in New Jersey. For example, we have some primary sites at Princeton Medical Center, and that we try and work with you on finding a primary site that you share an interest with. The CRNA clinicals are also in New Jersey and Delaware. We do have two in Baltimore at Johns Hopkins and Baltimore Shock Trauma. For those, there is a student apartment for if you are doing your clinicals there. With the PhD program, can you minor in health policy and outcomes? The PhD program doesn't have minors, but you could take classes in those areas. It's a question about the BSN program. I encourage you to email us. Will also be webinars on the BSN program. Does the buy 3 get 1 free for Penn Medicine employees apply for both part-time and full-time students? Yes, it does. You still need to be an employee of Penn Medicine. Some people will go to school full-time and work part-time. And then once they get to the clinical portion, they'll either stop working or drop down to per diem. And at that point, the benefit would not apply. Can I apply to a job in the US after completing my MSN? That depends on visa requirements and the requirements at where you would be applying. Do you offer a direct entry MSN program for non-nursing students who have an undergraduate degree? We have an accelerated BSN. It's at the BSN level, not the MSN level. Do you offer help if we struggle in a course in the MSN program? Absolutely. As I mentioned, we have a lot of great student services. We have our own Office of Student Services. You have staff advisors. You also have specific faculty advisors as well. And we try and catch you before we see, a low GPA or something like that, but you can always make quick appointments, you can make longer appointments, and you don't have to talk to us either. You can go to counseling services, the learning center. There are a variety of services available. Are the CRNA clinical rotations divided evenly? I've heard sometimes pediatric rotations are less emphasized. No, they're divided pretty evenly. And if you're interested in pediatrics, can try, obviously, we can't guarantee anything, and there are restrictions on clinicals and size limits, but we can, if you're interested in pediatrics, can make sure that you get more pediatric rotations. Will the financial aid office be offering any information webinars similar to this format? Typically no, but you can send them an email and ask questions or schedule time to talk. Okay, any more questions? Still a few minutes left. Studying my BSN program in English, so no, you would not need to do the TOEFL or the IELTS. I believe I answered this question earlier for the PhD program. Can you minor in health policy and outcomes? There aren't minors for the PhD program, but you could take classes in those areas. What do you think sets UPenn CRNA program apart from the others? I believe 6 other programs within the area. I don't know the exact number, but you're probably right. There are a lot of CRNA programs in the area. First is as I mentioned, the integrated curriculum. Like I said, you don't wait to start clinicals. You start clinicals pretty much within the first 2 months. So you dive in right away. The faculty are fantastic. The program director, Dawn Bent, and the associate program director, Angela Rosa Di Donato, they are like your parents in a good way. They will make sure you are not struggling. They will make sure that you have the resources that you need. And all the faculty there, not just Dawn and Angela, are really there to support you throughout the process. Our clinical rotations are robust and diverse, and they really set you up for a career. You are, even though you're a student, you're taking on a lot of cases. You are, not just getting the ones that the anesthesiologists don't want, you're working on cases. And a lot of times, you wind up getting a job at that primary site. So you already have an established relationship there. And I can go on, but we don't have a lot of time left. Okay, what month does summer session begin? Summer begins in May. I know that's confusing. So spring begins in mid-January, summer begins in mid-May, and fall begins the end of August. And I thank you, Dawn, for went back to school at age 45 after a career in international sales, marketing and business. I took the 12 required prereqs before doing the ABSN program and survived. I saw the full court press for students who are struggling. They do everything they can to make sure everyone who should complete the program does complete it. So thank you for that glowing review. Our interviews for the CRNA program rolling are scheduled around the same time. Interviews will go out typically between December and February, so they are mostly rolling. Do international students in the MSN programs get funding? No, unfortunately, we can't offer federal funding to international students. What type of nursing master's degree is preferred for the CRNA program? You don't need a master's degree for the CRNA program. Are there any application fee waivers? If you are struggling financially for any reason, you can email us. We can review you for a fee waiver. And the PhD program does require an introductory statistics class. All right, any last questions? Some scholarships are, there's a question for international students about scholarships. Some scholarships are restricted, again, because they are mostly federal. The PhD program starts in the fall, so that would be end of August. All right, it is almost 1 o'clock, so I will stop now. Thank you everyone for listening. Again, this will be recorded, or this was recorded, and you'll get this emailed to you within a week. Good luck on your applications, and we look forward to reviewing your applications whenever you decide to submit. So have a great day, everyone.